go, we're recording. So I was just saying, Jamie, it's a real pleasure to meet you. And I hadn't really thought about how I would introduce the start of this interview at all. So it's probably fantastically unslick, but I guess it would be really lovely just to hear a little bit about your background and where you've got to now and what you found yourself doing.
Yeah, sure. So I suppose I've probably had one of those slightly meandering careers through various places. I studied maths at university and then kind of graduated and didn't quite know where to go and what to do. And I was working for a concrete company as a sales administrator. But at the same time, I started volunteering at a homeless drop-in centre in Waterloo, and really just, I think, enjoyed working with people. After about a year, I think, of Saturday mornings at this drop-in centre, got a job in learning disability as a support worker for adults with learning disabilities in the community, and just I sort of really fell for it. I really enjoyed kind of the care work. It was a really, really interesting experience because the residential home I worked in had sort of 6 guys living there. But I think I was the youngest in the nursing team by about 30 years, and everyone else had all lived in the same asylum with the same people for decades. And it was this kind of incredible education in grassroots, meaningful care, human interaction, as well as institutionalization, and this really kind of like complex stuff that I only really kind of later understood. But did that for a couple of years, and then went and did my mental health nurse training, and trained in South London, and then worked as a mental health nurse, staff nurse, for a couple of years in Hackney, and then as a ward manager and matron up in Luton. So lots of inpatient mental health sort of experience, really. And then I think around about that time, I was finding it difficult to stay, I think, true to my values. And then I look back at it now, and I found some of it really difficult, particularly the asking people to leave hospital when they didn't want to, and asking people to stay in hospital when they wanted to leave, and some of those really difficult dynamics in inpatient mental health care, I think I found quite difficult. And at that point, I applied to the Darzi Fellowship, and it was just fantastic. It was a real kind of opportunity to step away from something that I think I was finding quite challenging, but perhaps without really noticing. My Darzi project was, I was based in the quality improvement team in ELFT, and my Darzi project was around access to child and adolescent mental health services, and really kind of enjoyed that work, partly because it felt really meaningful, but partly because of QI work generally. I've always really enjoyed the sort of forming this team of service users and staff to make sense of what's going on around them and give them some space to try different things, and to develop ways of building evidence bases around whether things work or not, and whether their kind of things are better. And I really enjoyed that. After the Darzi Fellowship, I worked in the improvement team in East London for a couple more years, and then began supporting this community mental health transformation work, initially from a improvement advisor perspective, so looking to essentially do what we might to apply some of the thinking around testing new ideas, but in a slightly different context. So now thinking about developing new models of care and new ways for different organisations to kind of come together and integrate or dissolve boundaries, and to really develop a bit of a testing space around it. So my work now, I'm based I'm a senior programme manager working in our in the sort of East London system around community mental health transformation, and really kind of feel that it's in some sense my career's felt like it meanders around, and in some sense it's just felt like it's kind of, it all started to make more sense in the last couple of years. I don't remember it being that I'd identified this gap or this problem and that the Darzi Fellow was the answer. The Darzi Fellowship was the answer somehow. I just feel like I sort of stumbled into it a bit.
It's a funny thing, because I hear other people say that as well. It sort of came along at the right time, and I often think there's a reason. You know, people say right time, right place. I don't know if that ever entirely rings true, because I always think there's a reason you were in that time, in that place.
I think I was probably a bit burnt out. I think I was probably a bit sort of disenchanted, or feeling a bit that I really wanted to care for people, but somehow didn't feel like it was that the system was designed to support that happening. That there was just a bit of a disconnect, I think, between why I'd gotten into nursing and what was important to me, and what we were routinely delivering.
Could you expand on that disconnect? That sounds interesting.
I suppose that there's something about, in that sort of role and working on mental health inpatient wards frequently, I think you're confronted with your inadequacies quite routinely, and if you internalize those, or if you look to, if you don't recognize that there's a broader system around you, and that there's the impact of cultures and the way that teams are coming together or not coming together very well, being also a reason that that there's a dissatisfaction. If you internalize it, if you see it as something you're doing not well enough, then I do feel like you I've recently become aware of this kind of concept of moral injury, and this sort of gap between your values and your intentions, and then this, I don't see why I'm behaving this way if that's my values. And I think that sort of, I now think of that as being one way of, sort of describing this gap between what my values were, what I wanted to be doing with my work, if you like, and the way I was behaving and the way I was contributing. There seemed to be a sort of a gap.
What was it you think you took from the fellowship that, you know, is it fair to say, sort of re-energized you?
Yeah, definitely. And I think I look back at the fellowship, and I just think, if you were wanting to design something that would enable people to lead change in systems, the Darzi Fellowship was it. The headings of the modules, I think, were new models of care, and I sort of think that's absolutely where I find myself now. And I think it's core concepts of quality and kind of co-production within that, and that's absolutely where we are, really wanting to kind of engage with communities and service users, and leading change programs, I think, was the other module. So that's my job title, more or less. So it's kind of felt that I do feel I was kind of re-energized by it. I think it gave me the skills and the tools, to some extent, that I'd need to be able to go into complexity, to enter into complexity between organizations, and look to create space and pull for people to come together to enact change, and for people to come together and start to do things differently. So it definitely kind of, I feel like it was a really, really solid grounding, and grateful for it still.
Talking about some of those challenges, I think your line of work at the moment must be hugely complex, and lots of the challenges that you must find in that line of work are the challenges that are the same as in the wider NHS in general. What do you think are sort of the main challenges, both in your area and, I guess, applicably wider as well, to the wider NHS context? And What do you think is important in tackling those as we go forward?
In terms of integration, I think there's something really, really crucial about the relationship forming and about the coming together of people to build trust, people that are needing to deeply connect in ways that they haven't before. And there's something about there's a huge amount of technical stuff that comes with that. There's a huge amount of administrative stuff that comes with that. But right at the heart of it is this relationship stuff. And we're asking, particularly, I've really noticed it most pronounced probably in conversations with primary care and secondary care staff, the sort of gaps in the way they see the world and the way they see their role. And primary care with this sense of existing within a community, but secondary care often being this thing that people think that you enter and exit in some sense. I don't know that stands up to a great deal of scrutiny as a way of seeing the world or seeing your role. But there's something about these different mental models. So the challenge, I think, is finding an overlap and finding a way for them to meaningfully have a shared purpose when there's some quite fundamental differences in the way that those different organisations have developed, and often for quite good reasons, see the world the way they see the world. So the challenge for me is that that systems in the country need to see this as a chance to come together to rethink their place in a health system, and to give some ground and to find some compromise and to find some sort of some meeting in the middle. And it's not ultimately seen as some paper exercise in which we make things look uniform out front.
I'm hearing from all of that sort of like a big focus on how do we create meaningful relationships really across a significant cultural and social gap.
Yeah,
is that
absolutely? I think that's it, and I think it's interesting in working with teams on transformation that often people will quickly recognise others. It would be better if they changed, and it would be better if it would make more sense if they changed. And that is true from the perspective of the person, from the perspective of the person speaking. But it's very much about building trust and relationships across some of those different settings, I think.
I think that's a really lovely message to end on.
Yeah.
Jamie, thank you so much for your time. It's been absolutely fascinating to speak.
Pleasure. Nice to speak to you.
Wish you all the best and every success.
Thanks very much. Yeah, you too.